Leah Buckles from Prestige Worldwide Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former CMP examiner. So I want to come on today and discuss range of motion measurement or goniometry. This is a really important part of all CMP exams, essentially, that have to do with orthopedic conditions or musculoskeletal conditions. Why is it important? Well, because your function, a lot of your function can be determined based on how much range of motion you have, right? So a lot of veterans are mistaken that a specific condition or surgical procedure or something like that may get their rating increased. While that can be true for things like total knee replacements, especially in a temporary post-surgical standpoint, when it comes to the severity of a condition, you could have a really messed up knee like Adrian Peterson and have a terrible triad where you've got an ACL tear, you've got a medial meniscus tear, and a whole bunch of stuff going on, but you could have fully recovered from it, right? You could have fully recovered from it and you have great range of motion. Or you could have just a little bit of arthritis and you could have a ton of range of motion restrictions. So generally speaking, the severity of the condition itself doesn't necessarily determine what your rating is going to be, because it's really based on your function, right? So when we talk about function, what is a good way to measure that? Well, it's been determined that a good way to measure range of motion or functionality is with goniometry or range of motion measurement. So what is that? A goniometer, I have one right here, is a tool that we use that can help determine from a fixed place where I'm going to show you an example here shortly. From a fixed place, how much flexion, extension, rotation, abduction. There's a whole bunch of different types of measurements that we can take, but I'm just going to go over a couple today. So for the musculoskeletal system, the schedule of ratings can be found in the 38 Code of Federal Regulation 4.71a. There's numerous subcategories. So a lot of those musculoskeletal conditions, the actual ranges of motion that pertain to a certain percentage can be identified there. So if you have questions on this, you can go take a look. You can talk to an accredited claims agent or an attorney or a VSO, and they can probably provide you additional information. I am a medical expert. I'm a medical professional. I do not assist veterans in the administrative claims filing process, but I like to put out information that I get a lot of questions about that can be somewhat helpful based on my experience as a former CMP examiner. So I'm going to just quickly show you a range of motion of the elbow. Okay. I'm picking this one particularly because it is probably the easiest one I can show you while I'm making this video, right? And this isn't going to be perfect, again, because I'm doing it on myself, right? So there's two arms of a goniometer. There's the stationary arm, which is this one that's kind of fixed. And then there's the movable or mobile arm. And this is the one that's pretty much going to go along with your flexion or extension and measure what it's going to be. As you can see here, we have a circle that shows 360 degrees. So we're going to go with the elbow. We're going to go to where we're at 0 degrees. Okay. This is going to be 0. We're going to start at that position. So I'm going to back up just a little bit. So the stationary arm is going to go along the fixed part that's not going to move, which is my upper arm. Okay. And so we're going to see how much flexion I have, right? So what I would have the patient do, or the examinee do, is come to this stationary point that's at 0, put my tool at 0, and then I'm going to have them flex their arm. Okay. Flexion is making the angle smaller. Extension is making it bigger, right? So I'm going to have them flex their arm as much as they can. And then we take the mobile arm, which is down, all the way down right now. And we're going to move it, right? It's a lot easier to do with two hands, right? We're going to move it to measure about right here. This is where I'm at. Okay. I don't know if you can tell. This is kind of where that that mobile portion, it's going to align with where I could flex my elbow to. Okay. Then the examiner is going to take that and they're going to look. Okay. And this is showing that I'm at about 150 degrees. Okay. See it down here, 150 degrees of flexion. Okay. This tool just measured my flexion, and that's about what normal is. So again, this is not a perfect example because I just did it on myself, right? But this is an example of flexion and how that range of motion is measured. Now, if I'm back here and I'm at you know, I can only flex my arm up to here instead of all the way back to here. Obviously, that's going to be worse. Okay. So let's say I've only got 100 degrees of flexion. Okay. That's going to correspond with the Code of Federal Regulation where they tell the rater, hey, she's got 100 degrees of flexion. There's a corresponding portion in the CFR that tells the rater what that disability rating is going to be, whether it's 10%, 20%, whatever it is for the elbow. A lot of it is going to be based on what that measuring tool shows your range of motion to be. Okay. They're going to measure it passively and actively. Active range of motion is when they're going to measure it by you moving the body part. Passive range of motion is where the examiner is going to grab your arm and they're going to move it for you. Okay. So don't get all salty with the examiners when they move your arm because they're supposed to do that. Okay. It's not that they're trying to be mean. They're trying to say that you're full of it with how much you're bending it. It's part of the actual exam. Okay. Now that doesn't mean that you have to move it past a point of pain, right? But it is part of the examination that they're supposed to measure active and passive range of motion. Okay. So if you want to learn more about range of motion, I have another video where I discuss knee stuff. You can watch it up here. I'm going to post it up here in the corner so you can click on it. Please watch that video, like and subscribe to the channel. And thank you for watching. Bye guys.